Hello, dear students and all the viewers. Welcome you on behalf of Team Marrow to this special session. I am Dr. Ashwani Kumar, your faculty of Human Anatomy, and we are thrilled to have you all here. We, your faculty team, is really looking forward to this session to guide you people to the best of our abilities. And also, it's time our thoughts get aligned and among we start working in a coherent manner. But before we get started, let me take this opportunity first to introduce you to our passionate educators who dedicated their life in teaching to the curious minds like you. Well, over to you, ma'am.
Hi everyone. I'm Dr. Rebecca James. I'm faculty in a medical college for the past 15 years. I'm with Marrow from edition 3 onwards, and I'm very excited to teach because I love to teach, and I always am very happy and thrilled to see you all live. Over to Dr. Krishna Kumar, sir.
Hi guys, this is Dr. Krishna Kumar here, your physiology faculty with Marrow. Hearty welcome to all of you guys to this Marrow family. I personally feel happy because my own sister's son joined first MBBS this time in Government Stanley Medical College, Chennai. So it's a happy thing for me to address you guys because we are all in the same stream now. So with that note, we can go for the session.
Okay, so guys, now we will have a conversation about everything, including your questions, your queries, your journey in the MBBS. Some of you are done with the internals, some you are looking facing the interval in few days time. So we will address everything. So I would request you people, in fact, to stay with us for the entire session, and we will be answering everything that you have in your mind. The chat box is also active, so that we will take care of your chats. But before that, let me say this in the beginning that starting strong in your MBBS in the first year is very crucial in building a solid foundation. Here are some points which I have in my mind, which I want to tell you before we dive into the anatomy, physiology, and the biochemistry part of it, which is dealt with by the respective faculties. The first thing is, there's this kind of race going on. There is no rush. I mean, there's time to learn right now. So please don't rush and focus on the learning deeply, and not just memorizing. This is a time when you learn. Like, people, you want to read the standard textbook. It's not just about, yeah, I have to finish off my syllabus. I know that even before the session was started, there were people who were like finished off with their topics, and they're not enjoying learning. They're taking it as a burden. Like, it's so much that we have to take it on us. And moreover, at Marrow, the videos that we have prepared for you, we have put a lot of hard work in it. It is about for your active learning. It's not just the video that you'll watch and just like you can just let it go. It's an active learning which we want you to do. We want you to make your notes. We want to be actively involved with us, and also try to connect the same thing, the theory and practicals together. Just learning the theory is not the key. Whether it's me, or I'm pretty sure that Dr. Krishna sir and ma'am will also agree with me on this, that our job is to basically connect those dots between the theory and the practicals. When you go to the practical lab, whether it's a physiology or anatomy, or the biochemistry lab, we want you to apply that theory knowledge in there. It's just not they're doing some precipitation reactions there, or just doing some blood tests and going to the dissection hall, just opening up the skin, and because your roll number is there. So whatever you learn in the lectures, whatever you learn in our videos, in your college, through your textbook, we wanted to apply that practical knowledge. And this is our main motto, to make your life easier in your MBBS, and not just to like core. This is not about just the core teaching only. So remember, this is the foundation of everything to come. And keeping all that, I would first request ma'am to put some light on the like building, how to build a strong concept and foundation using our Marrow app.
Okay, so let me tell you why Marrow or this app or any kind of app is important for first MB learning. So I remember my days when I joined a medical college. I was a bit late in joining. So most of the lectures were over, and I have no chance to see all those lectures back because that's already done. So the concept in the initial part of my journey in the medical college was not so good. So I was very weak in the subjects. And even if you have joined on the very first day onwards, I will say that most of you will be spending your time in the night time. Mostly you have logbook to write, you have records to finish, and maybe an exam coming soon. For that you have to prepare, which means your night time is, you are not getting a quiet sleep before your every lecture. And most of the time, in a medical college, your timing of classes is from 8 to 10. So you will be rushing to the lecture hall like anything, and you will be not in a mind to listen to any classes. I'm not saying that you should not listen to the classes. You should listen to the classes. That is very, very important. But at times it is not possible. We are all humans. So if you are not getting a chance to listen to the class properly, then in our times there is no way for us to go back and see those lectures again. But now the time has changed. Everything is in your fingertips. There comes the importance of Marrow. And remember, this is a dream of a medical student like you. So it is, I should remember Dr. Deepu Sebin here, because he was a medical student like you who brought forth this wonderful app called as Marrow. So, what is in it? It has around 180 hours of video lectures, which will help you for your descriptive answers very well. And it will help. The next, what is there is the QBank. We'll explain about this QBank later also. But now, why QBank is important? Because this will help you in the MCQ part. 20% of your question is now MCQ. So QBank is a crucial part of your preparation in your first year now. Then subject wise test. This is more important when you have completed anatomy, physiology, biochemistry during your study leave. The subject wise test is always useful for you. And very important, pearls, because revision is a part of every exam preparation. So to revise or rush through the topics in all the subjects, the pearls will guide you through. So yes, sir.
All right, guys. This majority of you know already how to get into this actual course, because this is not the only course available in Marrow. There are a lot of other courses too, NEET PG, NEET SS. But particularly to this Marrow for first year, how will you go? Very simple. Navigate to the menu on the top left corner. Just go to your courses where you will see Marrow for first years. If you just click on that Marrow for first years, that's it. Where will you land? Yes, sir. You'll definitely land into the beautiful world of physiology. We can go to that, sir. Yes, beautiful world of physiology. Not only that, you can also go into anatomy videos will be there, biochemistry videos will be there. Particularly concerned with physiology. Remember, guys, physiology is a highly conceptual subject, and these days it is entirely about the clinical orientation part. The theory part alone is not sufficient. You have to clinically correlate and read. According to me, if you ask me what is the biggest advantage of this course or Marrow for first years, see guys, by this time, in your departments, anatomy, physiology, biochemistry, minimum I'm saying 5 faculties will be there, maximum up to 10 faculties will be there. And they teach individual lectures, these faculties. But here in this Marrow particular course, there is one single faculty, me, for physiology. I will cover the entire physiology lectures. Compare this with your department, there will be minimum 5 to 10 people to handle that course. But here I am the only person who is doing that complete physiology. That means there will be definitely uniformity in teaching. So right from the first lecture till the end lecture, there will be total uniformity. So you have no confusion at all. By the time if you reach the mid part of the lecture, you will definitely get hold of what the faculty is trying to say. We get usually accustomed to each other through this lecture. So that's the biggest advantage. It is based on one faculty where the teaching will be totally uniform. Second important thing, reading this physiology, particularly they will ask you which book to follow, sir. The standard textbook always hold true. We have Genong and Guyton. The universal saying that is Genong is usually for MCQ multiple choice questions and Guyton is for theory exams is largely true. So I strongly suggest you to read Guyton right from the beginning days. Please do spend a minimum 30 minutes to 1 hour for physiology. Read Guyton. And in many colleges, I feel the department itself suggests you books and they will give you books. Indian author books you can read, no problem at all. But I strongly suggest you to read Guyton. And one more important thing you should never do that is, in the initial days, we try to read one book. Near the exam, some simplified books, we tend to go for that because that looks easy. Please don't do that mistake. Right from the beginning, always read from one book, and for your exam also, please twice and finally read from that book only. And coming on to the notes part, see guys, you will definitely have the individual faculties who are going to take lectures there. I am here to take you lectures, and we will have book as a medium. Particularly for this notes, guys, remember one simple thing: whether to watch lectures first or read books first, sir. See, book, for example, one topic, minimum 10 pages will be there. Lecture is just a synopsis of that. So I strongly suggest you to first go through the video lecture. So in that way, you will definitely know what this topic is about. Now, if you go to the 10 pages in that book, reading that will become very, very, very easy. So please don't read the book first and come to lectures. Remember, first watch the video lectures, then go to the corresponding topic in the book. And notes, there should be only one final notes for you guys. Whatever it is, you have lectures from multiple sources, you have QBank, information is there. Just write all these points and make into a single effective notes for your revision. You have inbuilt app notes, that is always there, but I strongly suggest you to make a personal notes of your own. Just like that, don't write everything which we say in the lectures. See, there are two types of note taking. First is just a passive medium. Whatever I teach in lectures, you simply sit there and write. According to me, the best method is the note should be a bidirectional communication, which means what, sir? Whatever I say, you simply write only the keyword. This is one way where the note should actually talk to you back. After some point of time, if you look into that note, just only one keyword will be there. You put a question mark, the notes will ask you, why am I write this? Then immediately you have to recollect what all points I have to be told in your lecture. So note taking should be always active. Just write only the keyword. So next time when you see, the notes will ask you the question back. Why this point is there? What's our thought? So immediately your brain will recollect. Your brain is beautiful, guys. You only have to focus and revise. Lot of points will definitely come to know. Physiology, lot of important information I have given you. If you ask me, the content here in physiology is far more than enough. So please do watch those video lectures and make notes and revise them effectively.
Okay, thank you, sir. Thank you for your input. And well, I think sir has already explained everything very well. Sir, you made our job easier. I think now ma'am and me, we have to tell a little less about how to go about our subject actually. But just to add few points to what sir has said, if talking about the anatomy, because there are a few things you have to take care in, especially in the anatomy part. See, in my subject, what is very important also, apart from what sir said, I agree to every single point what sir has emphasized on. Sequencing of topic is very important to me, and I believe that what happens is that you need to get over with the entire topic, and then you need to raise queries. Sometimes what happens, people will just read one part of it. Let's say they're using neuroanatomy, they just read the spinal cord only, and they start getting curious. I'm not getting the answer to this, although it is a very interactive thing. You have to know about a lot about the spinal cord and brainstem and other thing. So the sequencing of topic is important, and you need to get over with the entire topic. And then you need to ask yourself, okay, how much I understood out of this topic. Don't make a decision based on just one or two initial topic that you're reading. And I think it goes for every subject. And especially with mine, because let's say initially when you people were started with, most of you people started with the upper limb. So what I've seen is people were reading the arm and they were confused about, okay, musculocutaneous nerve, where is it? And then they realized, okay, the nerve is discussed a little later. So you have to wait for it, get over with this entire topic, and then you will get a holistic approach of the topic. So that is one very important thing for our subject. Particularly for anatomy, I would say that, as sir said, making notes is extremely important. And I think me, sir and ma'am, we all will advocate this point that making your notes is extremely important, guys. I know that there are beautiful notes which are available in the app, but no, that is for the referral. If you are on the run, if you don't have access to your own notes, so you can watch them, that is okay. But that will be a passive learning only. If you don't make your own notes, that active learning will never be there. You have to stimulate every sensory area of your body to make your notes. And for my subject, drawing the diagram is also important. Now, nobody's testing you for your drawing skills. They don't want you to be any artist to draw the line diagrams. It's not that how beautiful you can draw. Technically, your diagram should be correct here. That's why you must have seen in my videos, I've emphasized so much on the line diagram, because you have to present the answer to the examiner in the shortest period of time with the technically correct content. As sir said, watch videos and then move to the standard textbook. That's the exact point I have. that once you watch the videos, our job is to make your life easier in the textbook. We all advocate and emphasize on reading the textbook. Yeah, definitely you have to read the textbook. If you don't read the textbook in first year, for the first year, when will you do that here? There will be time in your life when you'll be preparing for the higher exams, PG entrance examination. Then obviously you will not have time. You will be relying on the notes and the some other short methods. But right now it is the right time. In whichever respective year you are, like you are first year students, you have to read the standard textbook. And when I say standard textbook, like it can be a matter of choice, like whether it is Vishram Singh or B.D. Chaurasia or Snell's Anatomy, whichever book is comfortable with you. It's always about, like, book also is, sometimes we kind of feel more connected with the book. So whichever it is. But as a recommendation for the anatomy, the atlas is also very important. And I'm a very big fan of Netter's atlas. And the reason I'm saying Netter's atlas, because that is not too complicated. It's not a cadaveric images. It's a schematic pictures shown in a way that the way it look like. You can compare it with a cadaver here. So it is a right amalgam of the schematic diagram and the cadaver picture. So my recommendation is very strongly go with the Netter's atlas. I'm very influenced with the Dr. Netter's pictures. One more thing, that see in our every subject, obviously, and especially for the anatomy also, the revision is very important. And videos will not keep on helping you in that regard. And that's why sir has emphasized so much on the notes, because if you have your own notes, you write something with your own hand, written something with a red color on the right corner, left corner, so you tend to remember that more of it. Whatever the printed note material notes you will have, you might find them very fascinating, but later on you'll forget them. So you have to have your own notes, because after a couple of months, when you fall back to the same topics, you want something to look familiar to you, and only your handwritten notes can do that here. One thing which I have to say, and that is with more in context with sir, because biochemistry is little different from my arena that way, that we do have to respect a little overlapping also. Like for example, like in my neuro lectures, I haven't talked much about the basal ganglia, because I know sir has talked about the basal ganglia disorders and all that. So he's taken care of that. So reading the same thing from two different sources, it may not be the great idea. So when I saw the videos, when I saw Ki sir is recording wonderful, like he taught the basal ganglia beautifully. So I think, why would I like bother teaching you the same thing with the same app? So understand that if something is not given in the particular app, you please switch to the other part and find out, is it given somewhere else also? Maybe the same goes with the physiology also, because some part of like tracts and everything, I have discussed the tracts in quite a detail. Sir probably were told about more about the physiology part of the tract. I've talked about the like anatomy part of the tract. Okay, from here to where it is going, this part of the brainstem. So neurophysiology and neuroanatomy, I think sir would agree with me that these are two topics you should be reading simultaneously, because to stay in that to jump. Well, rest, I think most of the things sir explained. I would just say, guys, stay curious, stay disciplined, and trust that you whatever hard work you're putting in now will pay you off when you will be facing the real patients. So yeah, it is going to be great. So over to you, ma'am, please.
Okay, so let me tell you something about biochemistry. I know that most of you don't like biochemistry, because that is the 80% of the time you're spending for anatomy, 15% is for physiology, and only 5% you are leaving as for biochemistry. It is for sure. I am seeing students for the past 15 years. I know that. Okay, so that is what you always do. But in spite of that, what I could say is that always remember, biochemistry is something which you feel that you forget very soon, and you feel that biochemistry is only cycles and enzymes and all. No, once the competency based medical education has been once the inception of that, what we expect from an Indian medical graduate is to be a first contact physician, and that preparation should start from the first year onwards, which means every subject, not only biochemistry, every subject from the first year itself, you have to see it as a clinical subject. So you have to see biochemistry as a clinical subject. That's the point number one. Number two, your exams is actually focused on that, which means your exams are not simply asking about just what you say as one essay question on glycolysis. Yeah, it should be there, but along with that, we have added, like the CBME, the NMC have added many scenario based questions in your exam paper. I know that most of you have done your first internal exams by this time, so you have seen most of the scenario based questions also. So how to learn these scenarios in biochemistry? So please do see my introduction videos in the Marrow itself, where I am saying how to find or how to do an applied learning. It is not possible for you to learn in the very first time when you're learning biochemistry. It is not possible for you to have this applied learning part. So that comes only after once you've completed a topic, for example carbohydrates or proteins or anything. So in that matter, so only once you have completed your topic, then only you can understand how to find the scenarios or clinical applications in that. Now once you have completed a topic, what you have to take is a top down approach. That is, you have to give more importance to the applied aspects, then connect it to the metabolism and to the rest of the chemistry part. This is how you do an applied learning. And next thing that I want to tell you is that don't learn from the page 1 to the page last of any books. It is not possible for you to learn everything and go for any exam. So we have to prioritize the topic. So how to prioritize the topic also, please do see my introduction, because in this short session I won't be able to say how to prioritize the topic. Please do see that introduction video where I'm clearly mentioning how to prioritize the topic. Once you have prioritized the topic, then give importance to the high weightage topic, then only go to the rest of the topics. This is how you can master any subject, not only biochemistry. That's way the same thing you can apply for anatomy and physiology as well. So this is what I want to tell you. And always try to make a mind map of all the topics. Once you have covered the major topic, at least you have to make a mind map of all the topic, especially the topics like physiology and the biochemistry, which you feel that you forget very fast, or anatomy, whichever you feel you forget very fast. Please do make a mind map once you have completed that topic. And lastly, how to write an answer. This is a question that every student is asking me. So, I know that you're all MCQ capsules after NEET UG exam. You don't know how to write a descriptive answer. Your pen will not move when you answer any exam. I know that. We have faced it. Personally, we have faced it. So, what I say is that when you learn, try to write points and learn. Then that way you will try to organize the notes, organize the topics to headings and subheadings, and try to write the points under that. So that way, when you are going for the exam, you just go through those headings and the subheadings, then you start writing. So if you have that in your mind, then your pen will move very fast. And if possible, please do write and learn. If you get time, please do write and learn. Otherwise, that continuity in writing will not come to you, because you are all into this MCQs for the last 1 or 2 years. Maybe that how to write a descriptive answer is it's a bit difficult for you in the first year. So you should learn the art of descriptive writing. After first internal, it may be a bit difficult, but once you have reached your second internal onwards, you should master the art of writing descriptive answers. And then what you have to keep in mind is, once your headings and subheadings are clear, the next what you have to keep in mind is, always write as bulleted points. Never do a paragraph writing. Then, as Sir Ashwani sir has said, you draw diagrams and flow charts. So that will make us also to give marks. We will give you enough marks if you have enough diagrams and flow charts in your answer paper. That's for sure. Everybody will agree with me in that aspect. So this is about biochemistry. So if please see that introduction video of me, so that you will get how to an idea about how to prioritize the topic and what to learn in biochemistry and all. Okay, so now we will see something about the question bank. Why question bank is important? Two reasons. Number one reason is, when you are in a 11th or 12th standard, you have a prescribed textbook in front of you, like an NCRT textbook. You just go through those topics, and the MCQs, you will answer, because you know from where the MCQs are coming. But when you have reached your first MB, it is not like no prescribed textbook. So Ashwani sir is saying about lot more many textbooks. I will also say many textbook. Krishna Kumar sir will also say many textbook for you. How to learn all these things? It is not possible, yes, it is not possible. So there come the importance of QBank for you. So I feel that this is one of the most exciting feature of this app. So the QBank is custom made for FestMB. It is not a complicated MCQs. It is very simple MCQs, which is usually that you expect during your FestMB exams, in internal exam as well as in the university exam. So it is very exciting to have this with you. So from this you will understand, once you have completed a topic or once you are doing a topic, you just go through the QBank. This will help you to make a foundation to how to answer a questions in MCQ and how to learn for MCQs. So this is what I want to say in the QBank aspect. Yes, sir. So Krishna Kumar sir will tell you about the subject-wise test and pearls.
Yeah, I want to continue on that point with QBank also. See, guys, particularly with physiology, whenever you watch any lecture or in your college, if some lecture is taught, so just read the topic, make notes, and side by side do that particular topic QBank. These QBanks are basically like MCQs for you. In many universities, presently the MCQ system is there. Minimum 20 marks is there. One simple logic, guys. 5-mark questions, essay questions is not there for you taking. It's upon the examiner. He can give 8 marks, he can give 9 marks, but this MCQs, remember, the mark is there in your hand. If you mark it correctly, it is your mark. Nobody can stop you from getting 20 out of 20. But essays and short answers, it's upon the examiner. So that is the importance of this MCQ. So whenever you read QBank, please use this as a learning material. There will be a lot of additional points there in QBank also, and please to add those keywords in your main notes also. Now, subject-wise test. What's the basic difference between this QBank and subject-wise test? This QBank will have only a topic-based MCQ. For example, cell junctions, only that MCQ will be there. But the subject-wise test covers the entire physiology, entire anatomy, entire biochemistry. So maybe at this point of time, if you look into that subject-wise test, for example, those 50 questions, many you actually may not know. 2 ways to look into this. Either you take this subject-wise test at the end of your first year MBBS, where you have study holidays, where all the major systems are covered in your colleges, you have watched lectures, you have some idea about these topics, that time you take. Or if now at this point of time you want to take, just for practice sake, you can take that and you will basically get an idea how the questions are going to come. And pearls, always remember, guys, use Marrow as a multi-purpose material. This is what I always say. It is not only just to clear your university exams. There are a lot of important features here, particularly to write questions, the answers for that, you need flowchart. Most of the pearls are devised in such a way, they look like a flowchart. They look like a table. They will have some diagrams in that. So whenever you travel in a bus or whenever you go to your home, that time you look into these pearls, you'll get a lot of information. There will be loads of information in these pearls. Pearls are gold mines. I always say, lot of important points you get by reading this pearls itself. Similarly, the subject-wise tests are always there for anatomy and biochemistry. Now, sir will highlight on that part for anatomy.
Well, sir, you rightly said, you and ma'am are already pointed out about that importance of MCQs. And what you said about the MCQ is so right, that the MCQ is having a fixed mark. So there's something nobody can take away from you. No matter the examiner is in good mood or bad mood, if the answer is correct, it's correct. And one more thing, I feel that when you do MCQs, it's a very good self-assessment also. That if somebody understood why all the competitive exam are MCQ based only, because that's the shortest format in which you can test someone's knowledge. So MCQ is also a good way to look at that, how much you understand the concept. If you read about some topic in anatomy or biochemistry, physiology for that matter, and if you just go and try some questions in that, so it's like you kind of asking yourself, okay, how much I understood, how much I can apply in the clinical of it or on the MCQ basis. So that's why subject-wise tests are important. And very rightly, sir said that pearls are something which are very beautifully made. And I'm amazed to see so many pearls that, okay, this the information can be presented in this way also. And it is right that you should be using it as a platform where it is not just about watching videos and doing questions. When Marrow is offering so much to the first year, I think you should take advantage of everything. And pearls is definitely something which I'm really fan of that. and getting a lot of information in just one snap only. That is really wonderful. I believe from this point onwards, let's move on to some of the questions, sir and ma'am, which people have raised, and we got some of the frequently asked questions, and I think we are already bombarded with the questions earlier as well. Like one of the question which we can see some of the questions in the chat box also, and we will try to address them as well. Now, one of the frequently asked question is that what should be our primary focus in first year? How can we establish a basic structure to handle multiple items without feeling overwhelmed? Well, ma'am, uh, what this is because basically overwhelming is something which comes because of you are not committed from the day one to it. I would say that even if you spend, let's say, 1 hour or 1.5 hour a day, but consistently every single day to your studies, watching videos, making notes, reading text, whatever, just 1 hour or 1.5 hour a day, you will realize that by the end of the month or like a couple of months, you've gone like way too far. So it's this that we keep on piling it and we just wait for the exam to come close to it, and then people will get panic. And as people are saying in the text comment box also that the first internal they did not do well, some of you, and some of you are scared of the first internal. That's okay. First internal, I guess it's usually eye opener for everyone. I guess no one did very well in first internal. Even we did not do very well in our first internals. So that is just usually an eye opener only, and this is where you'll get to know how to approach it. And I think from here onwards you'll start taking things more seriously. And when it comes to handling too many things, it is not handling too many things. It's just about starting and giving time every single day. Like every day you have to put in the effort. You just cannot leave a couple of days and you think I'll just give 1 hour on Wednesday and 1 hour on Friday. That won't work. If you, for some reason, if you're not able to commit today on that table for an hour or so, you have to compensate to tomorrow. It's a very consistent effort, but it is not a rat race. You don't have to sit for 15 hours a day, and that is like, this is now how it works. You don't have to burn yourself mentally. So the three people on the screen right now, that's your primary focus. I mean, our subject is the primary focus. What else you will primary focus on? So subject wise approach, as ma'am said, prioritizing your topic, knowing that what to read. Sometimes we are reading things for the heck of it, but there are certain things which are very important clinically and you have to carry them forward. So awareness is also very important for that. So that's what I would say, that overwhelming come to those people who procrastinate, who don't plan it. If you plan it well, you will not be overwhelmed by the topic. That's we even if somebody solely sit down and watch our lectures, our video lectures, I think they can finish off the entire three subject in 1 month itself. That's how much it is doable, thankfully to this platform, that we have access to such things. So I don't think it should be bothering anyone. There is another question which is about, ma'am, I would love you to answer this question, which is about badly performing the first internal, which is a very common question nowadays.
Yes. I know you are facing it now. I performed badly in my first internal. It's as sir have already said one point, that we all failed. We all failed in our first. I failed in all the. I think except for physiology, in biochemistry and anatomy, I failed in my first internal exam. So we all have failed. That is not the ultimate failure. It is actually a stepping stone to your success. So, according to Winston Churchill, he said, success is not final, failure is not fatal, but the courage to move forward is the one which matters every time. So if we fail, then you just think about the first step that you have taken in your younger days. We will fail, we should fail, otherwise we will never learn to walk. So these tough times is making the real tough people, and only the tough people move forward in the real tough time. So this is what I want to console you, that don't get desperate by being failed. I know that you're all toppers in the plus one and plus two, and now we are in the medical college, failed in all the three subjects, or maybe two subject or one subject. Like for me, two subjects. Okay, so this is what you have to take. Reflect why I failed. So, is there any point for me to improve, to find it out? So that is where you have to, that is how you can be successful. So this is my ultimate word. So don't get desperate by being failed in your first internal exam. By the second internal exam, you will you will get more grip. So even if I failed in all the subject, like two subjects in first internal, I passed with 75 percentage mark in the first year. So it is because I understood how to learn it. So now it is like a derailed situation. Once the bogey is in the rail, then the flow will be very smooth. So till the time that you are properly railed to the track, then it will be a bit difficult for you, just like your first step. Believe in yourself and take the steps ahead by reflecting what happened, so what next. This should be your motto. So that is what I want to tell you about this failures in the first internal exams, sir.
Very well said, ma'am. Sir, this question is specifically for you.
Yeah,
It's
surely.
about the
I'll take this question, sir.
yeah.
But before that, the previous two questions, I just want to add a few things. Regarding that overwhelming part, remember, guys, it is not only you, it is overwhelming. Even for me, even for madam, even for sir, many things are overwhelming. Even just to a 1-year-old boy, if you show the food in front of him, it is overwhelming for him. So it is there for everybody. This is the world of T20, guys. You always remember there are sides who chase 230 runs, 250 runs. How? They never leave things to the end. Right from the beginning, they maintain the run rate so that in the end, the run rate won't go far away. It is the same logic we have to apply daily, steady, small amount of time so that in the end, nothing will look definitely overwhelming to you. And second, regarding the internal exams, don't just think only on that one part, guys. Always remember it is a long-term process. See only that long-term endpoint, that is your university exams. In this days, what we mostly lack is not the time. Remember, time is there for plenty for everybody. What we lack is the patience. So we definitely need to have patience. We only have to trust the process, prepare hard, so the next exam will definitely pass. Now this question, standard books always required. Remember, guys, theoretically speaking, standard books are always required, not only for first MBBS, second MBBS, third MBBS, final MBBS. Theoretically speaking, realistically, if you ask me, I'm a physiologist, the Genong, I read mainly in the internship period. So, but if you read it in the first year, definitely far more advisable strategy. Please to read the standard textbooks. Please to read in the first year itself. It will definitely help you a lot in the long run. Indian author books, if you like that, you can definitely read. Remember, the Indian author books are largely inspired from the foreign author books. So no problem at all. Whichever book you comfortable, and according to the college level, this question we have to answer, because there are many medical colleges, they suggest their own books. The best people to ask is your immediate seniors who are past there. So be a Roman while you are in Rome. So whatever book they followed, whatever they suggest, so according to that, you can follow that. But standard books, definitely mandatory. If you are capable of reading that at this point of time, definitely it is advisable according to me.
Yeah. Even I want to re-emphasize on this what sir said. Ki yes, seniors. I mean, this is a very important word sir used, that please do take suggestions from your seniors. Like you have to build in that relationship. It's in your medical career. Nobody is going to be more helpful than your senior would be. So I would say that you need to approach them, and it's not that they will come to you. You have to approach them. You need to ask them to mark important questions, because being familiar with what questions were asked in the earlier examination, what are the important topics, you're reading to make concept on everything, but when you reach close to the exam, obviously you need to be focused on certain areas to formulate an answer in particular way, and this is where the senior plays a great role. So very rightly sir said that you have to have approach to your seniors and ask them that, okay, what book should I read, or what are the important topics that I focus on, especially close to the examination. There's another question. It is about what is an approach in formulating the answer in theory paper. I think I will take a input from sir and ma'am also on this. But if I talk about purely about anatomy question first, see, my subject, it's about seeing is believing. Anatomy is like, it is all what you can see. It is, you believe on that. Whatever topic is, I always said that, I keep saying that in my videos also, draw the diagram first. Whatever topic they're asking, just draw the schematic line diagram first, and that will basically create an impression on the faculty head that you know about that topic. You do not want to engage the faculty to read the text that you've written inside, because then they will tend to find your mistakes in it. If you create an impression, let's say there's a question on, for example, there's a question on the axilla. If you draw a well-labeled diagram of the axilla and everything is visible in that, then as a faculty, if I am checking your paper, I will not even bother looking into what text you've written there. Or maybe the like ma'am said that write in the bullets points so that all the major points are highlighted over there and you can look into it here. So for the anatomy questions, it is mandatory to start your question, start your answer with diagram itself. Nothing, no introduction, nothing. Just put a diagram first and then start with it. And finishing the answer strongly with a clinical point. See, we are reading these subjects because to have a more of a clinical orientation. If you talk about any topic and you don't mention about its clinical implication, and especially again in anatomy, if you don't tell about the clinical implication of whatever you're talking about here, that is always incomplete here. And as a unsaid rule, it is like when you write a clinical point about any answer or any topic which is given here, it is inevitably the examiner bound to give you an extra mark on this, because that lets you know how to apply that basic knowledge into the clinical. Same for the histology, guys. Histology, it's about diagram only. Whatever histology you're reading in your lectures, that is fine. Okay, that can be a little overwhelming at times, but at the end of the day, histology is all about the diagram. You have to just one single line diagram that you have to draw, make it in the circle so that you don't spill everything outside. You don't end up spending too much of time on that. So these are the few suggestions which I would give you based on that, how to attempt the anatomy part of it. Ma'am, something about biochemistry, especially about how to attempt the theory paper.
Yeah. So regarding not only about biochemistry, all the three subjects I'm saying, most of the university paper valuation is now online. So we faculties are valuing on screen means it is actually a scanned paper that we are valuing, and we have a set of keys in front of us. So that is what where we are looking for in the answer paper. So it's always, that is why I said write neatly, legibly, and try to underline or highlight the important points so that it's very easy for us to pick the key points whether you have written or we are not looking at the like the amount that you have written. What if we are looking, or the quantity is not what is important, quality is important. So if you want to give a good quality to your answer, we should be able to find the key points that the question paper key, whatever is in our hands, it should be there in the answer paper, which means those points you should be able to identify once you have completed your subject, and then that points should be highlighted in the answer paper, in the answer that you have written. This is what I want to specify on like not only for biochemistry part, regarding all the subject. This is very important.
Yeah, right. To approach this question, I first myself see this as an examiner now who is going to correct your paper. See, guys, we all love colors. There is no doubt in that. If your paper is colorful, that's all, more than enough. And it is not the information. Presentation of that information is very, very, very important. See, don't write randomly. Don't write random stuff. So you can relate lot of important points, something relevant to that question you answer. And please never left any question unanswered. Please try to fill the pages. Always write clinical correlation, as sir rightly said. All three subjects you try to write. Even then, if you are not able to get any clinical correlation, means be creative. Create your own clinical correlation. Something, for example, if you read a muscle, you are not able to get anything. You write, this muscle can undergo fatigue. This muscle can undergo paralysis. Like this, you yourself can create some logical, reasonable correlations. For physiology particularly, please do use lot of flowcharts. As I told you, for that pearls will be helpful, and please do write bullet points. Essays, we usually say write for up to 6 pages, diagram should be there. And for short notes, write minimum 2 pages. This is something I want to convey.
Sir, could you continue on this next question also, which is about when should a person start solving the question bank module?
Yes, sir, absolutely. I already touched on this point. Ideally, when should you start solving the QBank module? For example, the first lecture in physiology is homeostasis. Your college lecturer have taught you, I have taught you, you read that. Immediately, there will be a QBank module. Please do that QBank module. That is the most important relevance of that QBank actually. Today, you read homeostasis 1 month after, if you do that question, what will happen? No use at all. So immediately after completing that particular topic, do that particular QBank. Any important points you get, if at all, if it is not there in the video lecture, they all come together finally as a one single unit. So that note should have whatever additional points you get from the QBank. Even from QBank also, no need to write every single thing. Just write only the important keywords which are actually in bold letters. Please to make use of that. They are definitely useful for your university exams. As I told you, the 20 marks of MCQ is there for you for the taking. So if you solve this QBank, many MCQs, not only university exam, even NEET PG, INACT level exams, you can actually clear with the help of these QBanks. University exams, you will definitely clear MCQs with this QBank. They will be lot of help to you. So at the end of one topic, do that particular QBank, and it will be surely helpful for your university exams.
Sorry, you already have mentioned about the subject-wise test, but ma'am, I want to have your input also regarding this subject-wise test. Now, should I, like, a person should wait for all the topics to get over, or before start solving them?
Yeah, sure. So subject-wise test is actually consisting of all the topics in every subject, which means I feel like you can answer it once you have finished all at least 60 to 70% of your topics after your second PCT. That's the right time that you can start with your subject-wise test. Because if you do now, I feel like you may feel desperate. How are we going to learn all these things? So it's better to start after your second PCT, so that almost 60 to 70% of the topics will be covered. So that is what I want to tell about the subject wise test. And during study leave also, you will get enough time, so you can practice. And as sir said, this will help you, which is your, like, once your all the subjects or all the topics are over, this will help you to find out which is your weakest topic also. So in that way, you can focus more on those topics during your university exam preparation. That is what I want to say about the subject-wise test, sir. Yes.
Thank you, ma'am. Well, I think we'll take some questions from the chat box. I can see a question about the embryo and histo being raised a few
I
times.
think most of the questions are from anatomy only.
Ma'am, maybe
Yeah,
they're more scared of the subject. Okay.
No, we actually request the users who are watching this video, please to come up with your genuine questions, guys. We are here to answer for that. Now it's your time. Please to come up with some questions.
And to address that thing that about embryo and histo, when somebody asks me that, okay, is this enough or is that enough? Enough is not enough. I mean, we cannot say the word enough here. My job is to make you motivated to read a subject like a topic like embryology. People are generally scared of embryology; they run away from it. But if I push you toward the topic that you start reading it, so I've given a good start here. It's not about the sheer volume, guys. I mean, if we start recording everything, every single word which is given in the book, then what's the point of having the app that you can read the directly standard textbook only? Our job is to kind of be a little creative, take the context out of the book, present the topic to you in a manner that it is nice, motivate you to read more, so that when you fall back to those standard textbook or whichever book you're reading, you feel a little bit more agile, you feel more, you find it a little easier to read them here. So it's not about everything is there in the app here. Most of the things are covered. People who will watch these lectures diligently and work on it, we promise that in every subject you're going to get distinction 100%. Okay. But it's just that just don't fall for the volume only, just look for the quality. There is time management.
Yeah.
There's
Time management aspect. Time management aspect, we touched on many things, guys, but what we actually miss in the time management, apart from anatomy, physiology, and biochemistry, you also need to have time for some extracurricular activities. That is very important, guys. Please do involve some exercise or any activities for that matter. And one question was also there, how to have a good sleep cycle. If you do exercise, automatically the sleep will naturally come. Human body is devised in such a way that it releases a lot of important hormones for your body. You will get a very, very, very good night's sleep. So time management in the main video itself, we mentioned right from this day, even before that, if you didn't do that also, no problem. Always read anatomy, physiology, biochemistry for one single day. Every single day, you please read that, so that your internal assessment, they will definitely tell you in advance. So you'll have a better idea how much to study. As I told you, the T20 example, now itself you can paste that. Minimum 30 minutes, 1 hour you can study every day. So that time management is a long-term process. You just don't think for that one day, think for that complete course. The immediate one is your internal assessment, means within this time frame, how can I cover that? One day, anatomy, physiology, biochemistry, all you read. So in the end, they all will definitely come and help you.
Somebody is mentioning about the backlog. And I always say, why don't we have a backlog on Netflix or Amazon Prime? We always have backlog in subjects only, because we can binge watch those series, but we don't binge watch the lectures. I feel that the way the lectures are recorded is somebody just sit down for maybe find out a week, whatever backlog you have, you can cover it. And especially at this point of time, when it's just 3 months you have gone into it, so I don't think the backlog should be a big trouble for you. It could be a trouble close to the examination if you're not done with it. I think whatever backlog you have, it can easily be taken care of in 5-10 days only. You need to be just a little bit dedicated, binge watch those lectures here. If you're watching sir's lecture or ma'am's lecture, like sitting on the screen, like just don't get up before you finish off the topic, and make your notes here and be committed to it. Backlog will be gone here. It's like we are working for you. You just have to sit there and listen to us. So we are covering the backlog for you, but at least we need a commitment from you to sit there and listen to us.
Yeah.
Ma'am, could you just take a couple of more questions about it? Is like how to revise everything before exam, even if
That
important
question
topics be a lot.
how to revise
Yes.
everything before exams, even the important topics are a lot.
So let me tell you about the backlogs, and then from there I'll tell you how to revise everything before the exam. So regarding the backlogs, now most of you have completed your first internal. So if you feel that there are backlogs in the first internal, just leave it there. Now you have your second semester, or second, I'm not saying second semester, but the topics like the second PCT, your journey towards second PCT has started now. So just forget about what is there in the first PCT part. Now you focus on what you are going to write in the second PCT. Today onwards, this should not be the one day, it should be the day one. Like once your PCT 1 is over and you feel that you haven't completed everything in the PCT 1, I'm not able to cover everything. So don't worry. So take the next day as not one day, but the day one. So from that day one onwards, you try to be up to date in your topics. And I'm not saying that you learn everything on by heart on the same day, but at least go through those topics every day. Whatever is taken on the day, at least just rush through it, because maximum retention is on the day one. It is not after 2 or 3 days you will take maybe 2 hour or 3 hour or maybe one full day to finish a topic. So if you learn on the same day, then it won't be a big task for you. So that's the one thing that I want to tell you. Then how to revise all the topics. So it is not possible for you to revise all the topics in one go. So what you can do is you find a time. That what I did in my MBBS days is I have a time which I feel that I'm maximum alert and active. So this will not be the same for everyone. My time was early morning, 3 o'clock. So I used to wake at 3 o'clock in the morning. 3 o'clock to 6 o'clock, I feel that whenever I learn, that is maximum grasping power I have during those time. So I go to bed early at around 8 o'clock or 8 a.m. or 8:30 p.m. I will be on bed. But early morning 2:30 or 3 a.m. I wake up. So in that 3 hours, most of others will be, especially if we are staying in a hostel, most others will be sleeping. So you will have a very quiet time during those time, and you utilize that time and learn maximum. Okay, so this time you have to take for specifically your weakest topic, or which you feel that it is difficult for you. So spend that time for that. Okay, and rest of the time is like you have to divide. So after your one day of your whatever you have in your medical college, once you are back in the hostel, you divide your time. So first is for what you have to exam or some assignment is there, you have to spend time for that. Okay, so then the second part should be for the topic that is covered in that day. At least rush through those topics. So that is the second part of your time. And the third part is like for your backlogs, or to revise for an exam. If an exam is coming, if you have to prepare for that, you spend that third part for what you have to learn, like for those exams that is upcoming. So this way you can divide your time and you can manage your time. So it's a bit about the time management also, I've told. So always remember, you have to find the time that your brain is maximum alert. You spend the time for your weakest subject, and whatever is coming after your daily routine, you have to divide it into three. This is how you can manage time as well as revise all the subject. It is possible, dears. Yes.
Ma'am, just to continue what you said, that there is also a question about how to remember all the concept in anatomy and for physiology, biochemistry for a long term. Well, I don't know if it worked for everyone. I mean, I think you will also agree with me that I feel that whenever I used to find anything which I'm not able to retain for longer, I used to teach it to my friends. I always find that teaching something is something which kind of helps me remember it for longer time. So wherever I used to find, especially biochemistry, I tell you, because that really gave me nightmares in my first year, all this electron transport chain, tryptophan metabolism, like all that. So what I used to do is I just used to grab a friend of mine who already done with those subjects, but I'll request him, okay, just sit down with me. I need to teach it to you. And the moment I done teaching him, passively I'm learning more. So I've realized that the people who find it a little difficult to remember the concept for longer period of time, you can try teaching it to someone, and that way I feel it can retain little longer. Sir, your input on this?
Yes, sir. But actually, one question by person asks Kulkarni, he asked that question: how to improve the output of whatever we study? I think that's a very beautiful question. All the things, whatever we speak in this video, is actually targeted to that, guys.
Yes.
See, we are actually watching this video. For example, you guys, what is the output of this video? You have to apply. First and foremost, whatever we tell here, they are not just random words. You just have to apply. And also during reading, it should be active reading, guys, not simply just for time's sake. Please don't read. Suppose if you are reading 1 hour, means how to improve the output of that 1 hour. Only if you actively read. For that very simple examples, just go for imagination, or just tell your friend while you go for a mess, while you go for food together, you just tell him whatever you read so that you can remember better. Or just take some real life day to day examples. For example, if you read about cell membrane, means just like opening a door, the cell membrane is like a door. Relate with simple things surrounding you. In that way, you can definitely improve that output of whatever you study. So that output part is very important. Please do apply whatever strategies we are telling here, that then only all this will become effective. Otherwise, this is not just a simple question answer session.
Yeah, yeah. And I can also say, if one guy whose name is Krishna Kumar only, he's asking how many lectures should we watch per day, all three subjects. Well, I think you should keep watching it till you enjoy it. I mean, you also watch all these no, sitcoms and series till the time you enjoy it.
Even we
So
do get messages from students, sir. We binge watched all those lectures today. So it's upon the individual. Yeah. Yes, you continue, sir.
yeah, but all I'm saying is, like, it's not that you have to make a particular plan that I'll watch for 5 hours, I'll watch the video. It's like, if you're enjoying watching for 2 hours, watch for 2 hours. Maybe 1 hour is okay. If you like keep on going for 5 hours or something, you're finding it very interesting, so keep going with that. How does it matter? You don't have to be. It's as we all are emphasizing on that, the important thing is you are committing to sit down, watch those lecture, make your notes. And one question which is just gone by, so I want to address that. Somebody asked about these digital notes here. Honestly, I'm a fan of digital notes because there is so much of stuff you can add, pictures and all that. It makes your notes a little interesting. But the problem with people who make digital notes, they even practice before the examination on digital notes only. And in the examination, you have write on the paper. Honestly, me myself, nowadays when I write on the paper with pen, my handwriting, my diagrams are so poor. And if you ask me to draw in the tab, and I can do it very well. So I have lost the habit of writing on the paper. So I think making a notes on the iPad is okay, but I think from the revision point of view, before the exam, or when you practice something, diagram cycles, or I think you should do it on the paper itself here. Sir, some more questions, sir. Would you, ma'am, sir, would you?
Which is mostly suggest written notes or Marrow notes, because this is a very valid concern, guys. Writing notes along with watching video takes a lot of time. But please do remember, guys, this time you are writing the notes is like an investment of time. And this you are writing in your own hand while watching the video, so that you can minimize the time exactly in the examination hall. So that time, if you spend time here, there you will have a better time management, because you already know what you have written in your notes. If it is handwritten, that's why we always suggest you to go for, please to make handwritten notes. And please don't worry about the time while watching the video. Please to pause that, whatever you understand, write with your own handmade notes. And this is an investment time, so that you can minimize the time needed in the exam hall, actual exam hall, when it matters the most.
Mansoori Imtiaz has already completed physiology by you, sir. That's commendable.
Hats off, Mansoori Imtiaz. Good
I'm
luck.
looking forward to someone to come up and say I've done half of the anatomy at least. Not full. Okay, I think we have answered most of the queries. If anything, guys, if anything, please feel free to ask us. I think regarding Viva and before the examination, I think we can have more sessions like this later on. And I think we can talk more about exam-oriented approach close to the examination only. As Sir and my ma'am has emphasized that it's time to to invest time in learning. Don't worry too much about the examination. All you have time. This is a time when you learn and make the notes. So I don't think that
Yeah,
you should
regarding
worry.
Viva, I should say one thing
Yeah,
that
please.
nowadays the Viva is not pure theory Vivas.
Yeah.
So in all the subjects, whether it is physiology, anatomy, or biochemistry, if you are thinking about your university practical exam, the Viva is based on charts. Charts means the clinical questions. So you will have a clinical question in the chart, and based on that clinical or applied aspect only, we are going to ask. So ultimately, when you're preparing for your Viva, what is important is the core. It's not the core subject. It is not important. What is important is not the core anatomy, not core physiology, or not core biochemistry. What is important is the applied biochemistry. So you just have to focus on, once your topic is completed, you have to focus on the applied aspect, and that is what NMC is also required, wanting from you, to be the first contact physician in the community once you have completed your MBBS. So this is what I want to tell about the Viva part.
How to remember anatomy for a long time. You should paste my angry picture on in front of your table, and every time you'll be looking at me and just reminding you to revise it here. Well, guys, that's the only way to do about it. Like you have to revise the stuff here, and the more you keep on investing the time, obviously you'll get time later on to revise your. And that's
And
where
I
we
think
keep sharing.
like in the I feel like if you feel in dissection hall, the one who dissect is the one which is mastering anatomy the most, because he is dissecting or she is dissecting, and he's seeing or she's seeing everything and learning, so they will retain more. So I will feel that in the dissection hall, don't be so idle. So
Yeah.
you all take active participation in the dissection process, so that it is very easy, because I personally didn't do that. I didn't do any dissection. I was always in the backstage. So I feel regret for that now, because if you are active in the dissection part, then I feel it is very easy to learn anatomy.
Well, I mean,
It's not
dissection
like
hall is.
physiology or biochemistry. You can't see, anatomy is something which you can see and learn.
The dissection hall is no more only the place to take the Instagram pictures, with lung and heart and posting. And there's more about this dissection. So I think you should be utilizing your time, DH.
Yeah, they are asking hematology notes, please update. Don't worry, guys. Whichever notes that are missing, the team is working very hard. Very, very, very soon it will hit the app. And one more question, how to approach that clinical things. We all three faculties, remember guys, it's the clinical core edition. In our every single video of us, we will touch a lot of clinical correlations at the end, in between, everywhere. If it is possible, we'll always do that clinical part. So you don't need to have worry about that. You only have to watch the lectures. Clinical part will automatically will be touched.
Okay, I think, sir, ma'am, we should conclude the session. We've already taken a lot of time, and I should say that it's great to be in your company. We don't get to meet too much, but whatever the mode is, it's really good to see you both. So looking forward to see you soon, sometime, maybe in the recording studio somewhere. So, well, thank you, sir. Thank you, ma'am, for joining, and thank you, everyone, guys. Thank you,
Thank
guys, to be a
thank
part
you
of this
all.
video.
Thank you all.
Yes, guys. This just session there just won't end here. So it is an active learning. We have our Facebook group, Marrow Links group. You can join whatever questions you have. We also have our own Instagram handles. Any question you have in mind, please don't think, there will be definitely time for us to answer those questions. So you can post in Marrow Links or our own Instagram handles. You are most welcome, guys. And from all three of us, definitely good luck and best wishes to all of you. This is just the beginning for you.
Thank
So
you.
the first impression is always the very good impression. So use Marrow effectively. Good luck and best wishes.
Bye
So
bye.
bye bye.
Bye.